Genitourinary syndrome of menopause is a terminology that was just created a couple of years ago because it's a conglomerate of symptoms that some patients have. Symptoms include sexual dysfunction, urinary symptoms, and vaginal symptoms. Many patients will come in that are perimenopausal and menopausal to see me for issues that they're having with either vaginal dryness or mild stress incontinence, difficulty with intercourse, chronic itching, to just name a few. CO2RE Intima is a CO2 laser device that I've been using over the last 4.5 years to treat many of my patients who suffer with genitourinary syndrome of menopause.
Well, I had heard some really great stuff about her, and I knew she was a gynecologist primarily, so I wanted to speak to her about some issues that I was having. I exercise every single day, it's part of my habit, and I started noticing when I was doing jumping jacks and things with cardio, minor leakage. I think they call it stress incontinence. I didn't want that to happen. I'm only 50-something years old, and I wanted to see what I could do to correct that issue. And Dr. Patel was the one who had mentioned that, that this was available for women without having to do such other more severe surgeries, which I didn't want to go that route. I am really pleased with the results of the CO2 procedure. It was completely painless. She gives you a numbing cream prior to doing the procedure. And I was back to work that next day, no problems at all. I was able to have sex within the next 3 days or so, no problems at all. And yeah, I would do it again, and you should do it again if it becomes a problem again, because it's short term. But yeah, I would definitely do it again. I loved it. It's very non-invasive, quick, no pain. Oh yeah. So Dr. Patel is so easy to talk to. She's almost like your best friend when you meet her, because any questions you have, she'll answer them without any kind of hesitation. She gives you more information than you would have on your own, and I feel really comfortable speaking to her and asking her any kind of questions at all. She's very forthcoming.
I've had patients come in and have found relief after their CO2RE Intima treatments. Symptoms of chronic itching, vaginal dryness, and even stress incontinence have improved. Most of my patients require 3 treatments. Usually they're about 4 to 6 weeks apart. And then a maintenance treatment is required or recommended every 9 to 18 months in the majority of the population. This is sometimes used in conjunction with hormonal treatments like bioidentical hormones, but this is also an alternative for a patient that's maybe a cancer patient that's suffering with a lot of these genitourinary syndrome symptoms, but is not a candidate for hormone therapy. This is the one place where you're not judged. Come in and talk to me. You can tell me if you're having difficulty with sex. You can tell me if you don't like sex. You are normal. It is part of aging, and I'm here to help you.